again. Thank you all for coming. I wanted to talk to you a little bit today about risk factors, warning signs and symptoms, and what to do in case of a heart attack pertaining to women. As most of you may know, the American Heart Association says that most women do not have the typical signs and symptoms of heart attack as men do. That crushing chest pain, severe pain that radiates up to the jaw. They found over time that women just don't have the same symptoms as men do. So ask yourself, would you know if you were having a heart attack? Would you be able to recognize those signs and symptoms? And if so, would you know what to do? So that's what we're going to talk about today. According to a recent article in USA Today, heart disease is the leading killer of women. In fact, it kills more women annually than the other 4 leading causes combined, and that includes cancer. 1 woman dies every minute from heart disease. The reasons for this is because women do have less common symptoms, so they tend to minimize them, maybe even dismiss them, see if it'll go away, so then they take longer to get help. They delay seeking medical attention. That is why it is so important for every woman to know the warning signs, their risk factors, and what to do. So what are the subtle signs and symptoms for women? They can be very vague. You can have an uncomfortable pressure or squeezing or sense of fullness in your chest. You may have pain or discomfort in one arm or both arms, may even just feel heavy. Sometimes that pain will be in the back, can be in your neck, can even feel like it's in your stomach. Some women just have shortness of breath. They don't know why, they just can't seem to catch their breath, have no pain, no other symptoms. Some women break out in a cold sweat, may feel nauseous or lightheaded. A lot of times they will have chest pain as well. However, all those symptoms, as you can see, are very vague. You could say, oh, it's just that meal that I ate. It was kind of greasy, kind of spicy, so I'm just having this indigestion type pain. Take a couple of Tums or Rolaids, let's see if it'll go away. Oh, I'm so tired all the time. Oh, well, I don't sleep good at night, or I'm stressed about work, or stressed about family, so that's why I'm fatigued all the time. So you can see that with these very vague, subtle symptoms, women are much more likely to dismiss them and minimize them and just wait and see if it gets better. However, oftentimes they do not, and 40% of women that have a heart attack do not survive their first heart attack. That's a staggering statistic. And that's often because those first signs were not recognized, they didn't take appropriate action, they didn't seek emergency treatment. So what do you do? If you start having the signs, recognize them. Know those symptoms. Know how you normally feel. Know when something's different. If you start having those signs and symptoms, take them seriously. Don't go lay down for a rest. Don't go take a walk, see if you feel better. Don't take your Tums. Don't just dismiss it and keep putting it off and putting it off. Have regular checkups with your doctor. Discuss any signs or symptoms you may have been having. If you start having sudden severe symptoms, feeling really badly, you need to call 911. They will dispatch an ambulance to come to you. You don't want to be driving yourself. The personnel on the ambulance will actually start medical treatment on the way to the nearest emergency room. They will be doing things like giving you pain medication. They can check your heart on an EKG. They can give you oxygen. They can give you aspirin. And if anything starts to happen en route, you have trained emergency professionals that can help save your life while taking you to the nearest emergency room. Once you get to the emergency room, you need to be able to discuss your signs and symptoms with the staff there. They will immediately start working to see what is going on with you. They will check your heart, they will check your blood work, and if you are indeed having a heart attack, they will get you to the cath lab where the doctor can hopefully get that clot out or open up any blockages that you may have, and that restores the circulation to the heart. Time is muscle. Every minute counts right now. Early treatment and intervention is absolutely vital. The longer that blockage is there, the more heart tissue dies. The earlier you get that treatment and intervention, we can save heart muscle, you have a better outcome. So that's why, again, it is just vital for women to not dismiss their symptoms. Some things not to do. Don't think it'll just go away. Again, a lot of women, they'll take the Tums, They'll skip a meal, they'll go lay down, they'll rest, they'll think they're having a cold or a flu or stress. It's very important to get these symptoms checked out. If you go to your physician and they just dismiss your symptoms, you're tired, you're stressed, you're a woman, you're too young. Don't let them dismiss your symptoms. If they try to do that, find another doctor. Find someone who will take you seriously and get you checked out. Also, don't ignore your risk factors. Some of those are high blood pressure, high cholesterol, smoking, an inactive lifestyle, and a family history. Knowing those risk factors lets you know that you are indeed at risk for having heart disease and possibly a heart attack. So know your risk factors, don't ignore them, discuss them with your physicians, and take any steps that you can to minimize those risks. Last but not least, don't think it can't happen to me. Young women, 20s and 30s, have heart attacks. Older women have heart attacks. Don't think you can't have one just because you're a woman. We certainly see as many women having heart attacks as we do men. Again, sometimes it tends to be more fatal in women because it's gone on longer, they haven't sought that treatment, they've minimized their symptoms. So in conclusion, I want to make sure that everybody's aware of those risks, the warning signs, and knowing what to do. Know how you feel, discuss it with your doctor. If you start having the signs and symptoms of a heart attack, get emergency medical treatment. It could save your life.